Hey everyone, I'm with a former student of mine from Malloy University who graduated in 2022 and went on to get her master's. And she is struggling in some ways, like a lot of folks do, on transitioning from being a student to a practitioner and bearing the weight of major responsibility for people's emotional lives. So she's contending with feelings like still feeling like, to quote her, a child, and making these very adult decisions and being in the position of diagnosing. So, of course, feeling like an imposter comes up for her, and she feels like she's contending with imposter syndrome at times. And I think that she is a good representative of what many folks struggle with as they transition to the professional world. And that seasoned professionals contend with these same feelings for many years thereafter. So I think that we're going to all benefit from this conversation. But let me formally introduce her. Montina Montana Aquino is a New York-based social worker from Queens. She began her social work education at Malloy University, where she received her bachelor's and continued her education to receive her master's at Columbia School of Social Work. Montana is currently a psychotherapist at a behavioral health clinic in Elmhurst, Queens, where she provides individual, group, and family therapy to patients with severe mental illnesses and substance use disorders. She's worked in both inpatient and outpatient settings, as well as community-based environments. And I'm so glad to be back with her today. Hi, Montana.
Hi, thank you so much for having me here today. I'm really excited.
So glad to have you. Because as I said in the introduction, I think that the feelings that you're having are not unique. And I hope in the sense that that makes you feel a little bit better about having them, to sometimes not feel so alone in those feelings, but also sometimes I recognize that that doesn't really matter because your feelings are still your own. So why don't we just jump right in and tell me about what it is that you feel on a day-to-day basis, carrying a quite large caseload and having that level of responsibility.
I think a big part of it is in the field of social work, you only learn so much in school. And I'm sure that's for other professions as well. But especially starting at a clinic that has so many patients, you're just thrown right in. It's not really a gradual process of, all right, you have a couple patients your first week and a couple patients your second week. It's by the end of your first week, you're having 10 to 12 patients. And then by the end of your first month, you have 20 patients. And then by 3 months, you're up to like 45, 60. And it's a lot.
It's a lot, which is it's that kind of ridiculous. And I think that's one of the ways that our system is broken, because the overload, as we all know, leads to burnout, but it also leads to not feeling like you have a handle on who you're seeing, because you're just kind of getting ready for the next, the next, the next. When do you have the ability to process what just happened and what you've experienced in each of those sessions?
I think you just don't. And I think that's a really unfortunate reality. For instance, today I work 10:30 to 7:30. I see 9 patients every Wednesday. Sometimes when they cancel, it's great. Then I have time to do my notes from like the prior patients. But if all of my patients show up, it's definitely overwhelming. I have to get all my documentation done within a 24-hour period. I don't like doing them Thursday morning because Thursday I see 7 patients and run a group. So it can be really overwhelming.
Really overwhelming. I think it's so interesting that, you say, it's kind of good when somebody cancels because then you get to breathe, but you're not really
Mhm.
breathing because you're catching up on paperwork. You're still in that work cycle mode. But I think that, I have to say, when I carried a full practice years with lots of years under my belt, I still felt relieved when a client canceled because you just have to, not be in that intense emotional place hour after hour after hour, right? And then
Right.
I often felt, and I don't know if you experienced this, that rather than confronting them, and by confronting, I mean in a very positive way, in trying to learn about that missed appointment, the relief takes over and you don't even want to confront it to try and learn more about or try and get the client to kind of actually come back in. You're just left, with that relief.
Right. And I also think there's a certain level of guilt too, especially with the population that if I miss a call, after what could have happened. And then if I don't document that I touched base with the client and something did happen, it opens such a big deal. So I think there's a bunch of layers that I'm appreciative sometimes that a patient doesn't come so that I can do a treatment plan or I can catch up on a review or read the UR. But then it's, oh no, what if something happened? I need to make sure that my patient hasn't been admitted to the hospital or they don't need additional support. Um, but it's definitely a learning experience. Overwhelming, but a learning experience.
That's really interesting because I always I always say that too, and I always said that to myself that it's a learning experience. And that's what we do in social work, I feel like. I wonder if people in other professions do that as much, that with their sense of overwhelmness, they either demand a higher salary or maybe they look for another position. But for us, it's like it just comes with the territory. And yes, you are definitely learning and growing, I have no doubt. But you also, we have rights as social workers to have a caseload that just makes sense, but not only for us and being the best practitioner we can be, but also in service to our clients. Because what kind of service are we doing when we're kind of half present or, just thinking about like what's next or what am I going to do at the end of my day to catch up on everything that I need to catch up on?
I think everyone says that, and in school it's taught, and then when you start these positions, supervision also says it. But then they go ahead, not necessarily they go ahead, because there are patients, that need service. But it's not possible, right? Especially at a clinic like mine. For the last couple of weeks, I've had 61 individual patients. I've had some discharges recently. So I'm at 53 now. So I have a
Yay.
couple openings. Yeah.
Yay.
It's not going to last for long, but
Mm.
supervision's always saying, "Oh, do what you need to do so that you don't burn out." You keep giving me patience, so there's not really much that I can do. And if I advocate for myself, they will say like, "You can end session 5 minutes early." 5 minutes is not going to do anything, especially if the case is complicated. My note's not going to take 5 minutes. It's going to take 10 to 15 minutes, and it's rough.
It is rough. It is rough. So, yeah, well, maybe that's another irony in the field, right? That we promote self care, but the system isn't set up for self care. Like it's
Exactly.
right. So on those off days, how do you take care of yourself?
The off days, I'm doing treatment plans, reviews, following up with patients, going through discharges if I have any discharges. Sometimes I get lucky and I try to get all my paperwork done as soon as possible. And if I do that, I get to relax in my office. And I don't really have anything to do. I think that's also the beauty of the clinic that I work at. You have the work that you have to do. If it's done, you can take a break. If it's not done is when you run into the issue. So I'm pretty good at staying on top of things. When I am on top of things, if I have a cancellation, it's very nice. If I'm a little behind, it's constant paperwork, patient, paperwork, patient, paperwork, patient.
Right. I wish I had an answer for that. Like there's a part of me, I always talk about people that we don't have to fix everything. And there's that pressure, right? Especially when
Mm.
you're a beginner that you want to see results. So I have to fix. And I guess that's still innate in me. I've learned to manage that. But right
Mhm.
this moment, I'll tell you I'm having a hard time because I want to
Yeah,
offer you a solution. And I don't have an answer. The system is broken, right?
absolutely. It's such a structural issue, and I think there needs to be more conversations, but I also don't think there's time for the conversations on your typical
Mhm.
workday.
That is really true. So I assume you get supervision. I hope you get supervision.
I do. I have 2 hours a week. I have group supervision and individual supervision.
Okay. And during that time, are you able to talk about that piece or you're so desirous of, getting help with what am I doing with the clients that you're working with that takes precedence?
Absolutely. It's all case focused. All of us, there's 3 people in my group supervision. One of them has been there a little over a year. Then I've been there a little more than a year and a little bit more than half a year, and then a new therapist. So we're all just talking about cases and moving forward. I had some high risk patients that I was just newly downgrading to moderate risk. So I was really focusing on their care. I had some patients with some inappropriate behaviors that I was really focusing on.
Mm,
Another therapist had a patient pass away. So we just are always focusing on case, and I get great clinical supervision. But as far as
that's great.
absolutely, I'm so grateful for that. I think I'm really honing in on skills, but as far as structural and how to get things done, there's just no time to actually figure it out.
Right, right. And it bleeds into your weekend, your private time. Um, okay, so tell me a little bit about the imposter syndrome feeling when you're with clients.
I have a good amount of patients that are much older than me, and of course, it is brought up a lot by some of the patients. And then, of course, I'll say, do you think because I look young, I can't help you, or we'll move forward in that way. But at the same time, I hear them that, what is this young girl now? Especially like some of my patients are in their 60s, 70s, they have children and they're in these different situations. So I understand how it looks. And so in those situations, I'm a little overwhelmed. Like, yeah, what do I know? I read a textbook and I have a lot of knowledge as far as theories, but life experience, yeah, I mean it is minimal compared to some of the patients that I work with.
Yeah, that's a reality, right?
Mhm.
So, but how does it come up exactly? Do they actually say you're so young and you can't help me, or what do you know? How does that come
All
out?
all the time. Patients will ask my age. That's not something that I disclose. I'm not big on self-disclosure in session, um, which a lot of patients don't like. But I need to maintain that boundary for myself because you're not my friend. This is work. It needs to be work. Of course, we can still establish rapport, but I'm not big on self-disclosure. So, questions like, how old are you? How long have you been in the field? What do you know? Um, that comes up more often than I'd like to admit. And I think I've gotten good with addressing it, but it still, strikes up feelings in me. And then I get overwhelmed in session. So I'm like trying to breathe and do like EFT tapping techniques under my desk and, like really calm myself down because I do get overwhelmed because I don't want it to look like I don't know what I'm talking about because I am
Hmm.
competent in my skills as a social worker.
Hmm.
But it's true, I am young, and it absolutely comes up more than I'd like to admit.
Um, more than you'd like to admit. That's an interesting way of putting it, right? More than you'd like, or more than you'd like to admit. Why? What is hard about admitting that?
I think a big part of my practice and why I wanted to pursue higher ed and I made sure to get my master's is because I wanted to be respected as a professional. I wanted to have all of my credentials. I'm licensed, What do you know? I'm the professional here. But still, it still comes up like, what does she know? She's young. Like, of course, it
Right.
doesn't matter that she's studied. It doesn't matter that she's licensed. It look at her. She doesn't know what she's talking about because she looks like a baby.
Well, I totally appreciate that feeling. I don't know if it's helpful to hear, but I lived with that for a very long time
Mhm.
as well, right? Because it's just comes with the work, right? I mean, and,
Mhm.
and the truth is, like, now, if I were seeking a therapist, I wouldn't want somebody your age, right? I mean,
Yeah,
it's a reality. I want somebody who has enough lived experience, right?
right.
On the other hand, I really feel like if you embrace your belief that you deserve to be there and that you do have the knowledge of a social work education and more importantly, the ability to want to understand where somebody's coming from,
Mm.
that will make you appear knowledgeable. I mean, you are knowledgeable. You know what I mean? That your confidence makes other people feel confident in you.
Mhm.
So I know that this shakes it, right? You had it, you felt good. I
Mhm.
have my license, I have my education, and now that's totally being shaken, right? Because
Right,
client after client is saying to you, give me a break. You're just a kid, right? In
right.
other words. But and of course it shakes it, but you have to believe in your ability and you do have strong ability. I've seen it, in the
Mhm.
classroom. And I think that when you position yourself as wanting to learn from the client as the expert of their own lives, that that makes you feel like somebody who is capable of being in this position to the client, not even just
Mhm.
yourself, right? If I knew that somebody really wanted to learn me from me, because I remember I also had clients who would say, "Oh, you know it all from a book," like you even just said, right? Like
Mhm.
I have the book knowledge, but part of that's true, and that helps a lot, but it doesn't help as much as figuring out who this person is. So I'm
Right.
wondering if that feeling in you has dissipated over time with one particular client, right? With the same client. So I know it's resurfacing every time you start with somebody new, perhaps,
Mhm.
but with a same client, has that steadied over time?
Absolutely. That's been something that I hold on to. I think since I've been there, I think I've only transferred 2 or 3 patients. So the bulk of the patients that I was assigned, I'd keep. And a good amount of them are doing very well. Some are not, but that's, another story. But
That's par for the
um,
course. Yeah.
right, absolutely. But some of them that I feel like I'm not that like annoying little pest that you just get used to, and then they got used to me, and now we're really getting into it. And then they'll leave and they'll be like, wow, that was a good session. And I'm like, yeah, it was. And so, I mean, some patients who really didn't want to work with me were having really, really, really great strides now, which is exciting. And those are the things that I try to hold on to. I try not to harp on what do you know? Because if I did that, I'd never want to go to work versus the little wins that I have, I run with those.
Uh-huh. I think another way of maybe, I hope that this helps, is thinking about what they're really expressing is their vulnerability.
Mm,
That here they are in a position of needing help, and you are the one before them. And what does this mean? And what is this going to look like? And am I going to get the help I need? And I sometimes find that really a clincher in helping to kind of reverse that is not only what I said in regard one, it takes time. You have to develop
mhm,
trust, right?
right,
And how do you do that? I can say, you can trust me. I'm here to help you. But like until I show that and earn that, it means nothing, right? But
right,
sometimes just even saying to them, like, you're really concerned that I'm going to be able to learn you or help you or whatever, that immediately speaks to the underlying anxiety, and all of a sudden you've got them, right? Oh, you
right,
do understand. And that means more than saying, oh, I'm 20 something years old, right? And
right.
seeing where that lands.
Right, absolutely. I think one thing that's been really useful for me with first sessions is asking patients expectations versus realities. Because I think sometimes people think they'll start therapy and then immediately their problems will be solved, which in no way is the case. So I'll walk them through the process. And I also go over, we meet 45 minutes once a week. If we're talking about interventions and you're not implementing the interventions in your day-to-day life, you're not going to see any changes. And the biggest thing I always say to my patients is, you can't see changes without changes. And it sounds really annoying when I first start working that with them, but then after a while, it really clicks. And that's when we start seeing changes happen. And then I also think another big thing is I ask my patients for 2 things. And one is to show up for yourself, because if you don't come to session, there's no work to be done. And 2, to be completely honest with me about what's working and what's not working. If I recommend, or, we work on a coping technique and they try for 2 weeks and they don't like it, stop doing it. It's totally fine. We need to find what works for you. And I think that helps establish rapport that I'm not telling you what to do. I'm not reprimanding you. It's you tell me, like, you're the boss here. I always say, you're driving the bus and I'm just pointing out the exit.
Oh, that's great.
I
That's a great,
use a
is that
lot
your
of
own line?
analogies.
That's a
Yeah,
great
I use a
line.
lot of them. Yeah,
That's great. All right. So you're moving through, right? And you're
trying.
contending with a lot of intense feelings, which is hard. And I think maybe I've referenced this before, but I felt like for the first 5 years that I was doing this work, I was not in a good place. Like it was
Mm,
just hard because
yeah.
if you're someone who's willing to look at yourself and see what's coming up for you, you see a lot of stuff you don't like.
Mm,
And so that's why I always say that this work is so hard. Not only are you holding the emotional lives of your clients, and that's very draining, especially seriously mentally ill clients that you're working with, but you're holding your own stuff and constantly trying to manage that. And that weighs on you, right? But it gets better. It gets better. You have to believe that it gets better to get through
mhm,
it, because then it becomes a joy. Like the times that you get to actually be in the room where you're being questioned like that or challenged like that, it actually becomes fun. I know it must
mm,
be hard to imagine right now, but I'm
yeah.
just telling you my experience was it
Mhm,
was like this is painful, and now I love it. So there's hope. There's hope.
yeah. I'm
Um,
holding on to that.
yeah, yeah. So tell me more about like what comes up for you. What are you struggling with?
I think right now there are some concepts of things that you don't learn in school that you learn in the field, or things that don't typically come up. Is it okay if I talk about a case specifically?
Please, yes, but without identifying factors. Yes.
Of course, of course. I have a patient, a male patient, who's had some inappropriate comments to me that, of course, I've addressed in session that, this isn't the environment, that's okay. And then I try to ask why the patient felt okay making those comments about my appearance, the sound of my voice, how they would like me to play into their life. And then I speak about it in supervision. And we've talked about how this can be a really good clinical experience to learn to work with patients that are inappropriate, because that is something that is going to come up. That didn't come up in school. And I think that would have been useful having kind of a foundation of how to approach that versus being in session for the first time and having really inappropriate comments and then feeling like I'm freezing. Oh man, I don't know what to say.
Right. That's interesting. I'll take that under consideration. Seriously. Right. How to prepare for somebody who's making inappropriate comments to you. And I believe sexualizing you. Is that what you're referencing? Y-
Unfortunately, yes.
yes. And how uncomfortable is that? So uncomfortable. That's interesting that you say that because I feel like, I don't think you took my practice course, but I often give an
I didn't.
example, yeah, of a
Yeah.
of a client who I had right after school, just like that. So do you want to give some specifics and how you move through it so that others can learn from you?
Sure. So this patient has said that I have a very sexy voice and that the patient loves the way that I look and I'm this patient's ideal woman. And so the first way that I approached it is I want to talk about language that's appropriate to use with a medical professional and language that might not be so appropriate to use.
That's
Um,
awesome. That was instinctual, or was that after supervision?
that was my first session. My heart was beating out of my chest, my stomach
Wow.
dropped.
Good for
Um,
you.
I was like sweating. It was terrible. Luckily this session was on Zoom. That's the other thing. Initially, I was meeting with this patient on Zoom and then it transitioned to in person. And I was nervous when it transitioned into in person because on Zoom, I can, if I need to, I can hang up, right? In my office, that would be a little bit different. Um, then it became this patient would like to answer the Zoom call while he was in the bathroom doing a bowel movement, and would laugh when it was addressed that, hey, you can't really zoom in the bathroom. Um, why don't you put yourself on, mute and turn off the camera, and when you're ready, come back. And that came up a couple times. And so at that point, I had to say, if this continues, I can no longer work with you. And then comments continue to come up after supervision. I would say, would you feel comfortable speaking to a male provider this way? This patient's psychiatrist is a male at the agency. And I would say, would you feel comfortable speaking to your psychiatrist this way? Would you say that to your psychiatrist? And then this patient would laugh. And then I would feel kind of mocked in that situation because at that point, I knew that this patient understood what was going on, but was choosing to kind of ignore the things that I was saying. This patient also does have some cognitive difficulties, so it was hard to gauge in the beginning, is this patient actually understanding that what's being done is inappropriate? Or is this patient legitimately doing it because they like this type of conversation? And that was really difficult. Um, and then the transition to in-person happened. Comments continued to come up, and eventually the progress that I've seen is that now the patient will say, I really want to say something to you right now, but I won't. And I think that that's progress compared to actually making these comments.
Wow.
It's a lot.
That's a lot. That is progress, and it's kind of interesting, right? How we have to kind of reframe progress sometimes and think about progress. I'm sure you've had lofty goals about what you want for your clients and
Mhm.
what they're really capable of. First of all, I commend you on being able to sit with this, tolerate it, and continue through it, right? As opposed to kind of pleading with your supervisor to please change practitioners.
I wanted to. I
Yeah.
absolutely wanted to. And the idea came up, and I suggested maybe a male therapist would work best. But then I realized I felt like that was kind of a cop out, because it's true. There will be patients that do have comments and that will make me uncomfortable and make other therapists uncomfortable. And if I got rid of every situation that made me uncomfortable, I wouldn't be the clinician that I wanted to be.
Couldn't have said it better. Good for you. Really good for you. It's so funny. My first reaction when you said, "Oh, and on Zoom, I can always hang up on them," and I was like, "What? You would hang up on a client?" But that is a client, yes, that I would disconnect. Right? If they're in the
Mhm.
bathroom, like this is not acceptable. When you're through, or when you change your
Right.
behavior, we can resume. So absolutely, and I think you handled that beautifully. Um, I think, I don't feel the need to kind of guide you on that because you handled it well. There was nothing more to say. But what I do want to talk about is like what you were struggling with and what came up for you. And as you said,
Mhm.
like, you don't want to feel like a failure, that if I don't take this on, then it's kind of, I think you're saying you'd be giving up. Right. But there does come a point, I just want to say that when a client can't focus on anything
Mhm.
else but you, then it is time to end the relationship. But if you feel that there were, like you could move past this and he could then speak about other things as long as you set the limit.
Right. It was I had to set the limit often, but it wouldn't be the whole session that would be talking about me. It would probably be about 10 minutes of addressing it that we need to move on, and then the next 30 minutes we would talk about other things. There have been like the bowel movement sessions that took up a lot of the session, just because the patient wasn't getting it essentially. That I mean, he was getting it. He was laughing about it that he was doing those things. Those sessions were a little bit difficult, but also now that he's in person, that's not something that comes up. So I also have the ability to say, no, we can no longer meet on Zoom. You have to come in person. So I can do that to avoid those situations from happening again in the future.
You can also end the sessions when you're in person. If this
Yes.
continues, I'm going to have to ask you to leave.
Yes.
Right? So how did that transition go when you moved from Zoom with this particular person into person because you were concerned about, now he's seeing your full self?
I was very nervous. The day that the patient came in, we have a system that when a patient checks in, I get an alert on my computer and then I go pick up the patient and take them back to my room. When I got the alert that the patient was here, I feel like I went white and I was just like, I'm not ready to have this patient in person today. So I called the front desk and I let them know, hey, if I dial and I don't say anything, I need someone to come to my office immediately. And then I also called my supervisor and I was like, homie's here. Um, just so that you know. And she's like, no problem, I'll check in on you halfway through. And I was like, thank you very much. Um, and so he came in, and then I went over kind of rules and regulations and boundaries. Usually I don't have to do that when I start session with someone in person, but I felt like with this patient, I needed to.
Yeah.
I needed to express, I will never, ever, ever invade any of your physical boundaries, and under no circumstances are you to invade any of my physical boundaries. And then the way that my office is set, like I showed, like you're not allowed to cross this line here. And then I talked about we've talked about comments in the past, and you are not to be making comments about my appearance in the ways that you have. If there's an observation that you point out, that's okay. But as far as certain comments, certain language, that's not appropriate. So the first session went well.
Maybe you want to come in and teach a class on appropriate and inappropriate client behavior that you're saying is missing from the curriculum.
It's funny you say that. My supervisor says that I'm very big on boundaries for somebody that's new into the field, and I guess that I am. I really don't tolerate a lot of I don't tolerate things that make me that would make me uncomfortable outside of work. I will absolutely not tolerate it inside of work. Certain things come up, certain conversations, of course, come up that people get uncomfortable with, no problem, but you're not gonna make comments about how I look in my position. I don't like that at the store, so why would I be okay with a patient doing that? Um,
Well, I think for higher, I assume this person is mentally ill, right? Since that's the majority of your caseload. And when I mean
yeah.
mental illness is a big blanket, right? So what's his diagnosis?
Schizoaffective and major depressive disorder. And then
Oh,
there's definitely a cognitive impairment there, but doesn't have the diagnoses now, which we're kind of ruling out some things right now.
okay. But I assume that this inappropriate sexualized behavior happens outside of the therapeutic relationship as well. And
Yes.
is that something that has like literally got him into trouble?
not into trouble outside of the agency, but this patient is also working with another provider another female provider at our agency who he often does make comments to her as well. But she has a different position than I do. It's a peer advocate. So her approach to addressing the comments is very different than the way that I address them.
Hmm.
Um, she has the ability to be a little bit more harsh and the therapeutic dynamic, of course, I don't want to,
Hmm.
ruin the rapport that's been established,
Hmm.
but I also clinically, I need to address this, whereas she doesn't need to clinically address it in the same way.
Hmm. Hmm. Okay. Okay. But I'm assuming that even outside of your agency, this goes on. And maybe he
Probably.
hasn't
Yeah.
been confronted very strongly about it yet, but I would think that this is going to get him in trouble. And so I think even your modeling, right, is hopefully going to make somewhat of an impact, not only with you, but outside of your relationship. And
Mhm.
is he respecting the boundaries that you're setting, or is it a continuous struggle?
It's continuous. We'll have a couple good weeks and then a couple not so good sessions. This patient also has a lot of difficulties with frustration tolerance. So if the patient comes in already frustrated and then makes a comment and then it's addressed, the patient is incredibly frustrated throughout session. And then the goal is to kind of get him back to a better place, but then also continue to address the boundary that just because you're upset, it doesn't mean that you're allowed to make these comments to anyone.
Right. Okay, good. You're doing good work with him. And just a thought that when you're walking down the hall, this is what I imagine, right? And you're walking from the waiting room to your office. Is he walking in front of you or behind you?
So one of my social work trainings was at VNS Health, which is the community social work, and I was always taught to never have a patient walk behind me. So when we walk from the lobby to the offices, he's standing next to me, and then I key into the door, I open the door, and then he goes to the office first.
Okay, good.
Yeah,
Right.
the
Okay.
community social work training really came
Right.
in
That
clutch.
paid off.
Yeah,
Okay, good.
yeah.
Good. You to get a little something on that. All right, good. So tell me about is there anything else that comes up for you? Is there anything else you want to address?
I think with this situation too, it brings up my own insecurities about how I look, which is something that comes up, which is frustrating. Um, People commenting on how I look, whether it's good or bad, makes me think things about myself. And then in session, I'm thinking about how I look versus clinically moving forward with the patient. But then I need to, check myself. No, this is not about you. This is something that you're addressing with the patient. You can talk about this with yourself at 8 p.m. But right now, it's patient focused. Get over it. You have to move on.
Yeah, but like we don't really work like that, you know? Um, it's kind of like our clients, like, you can tell them this is what you need to be doing, but people don't change just like that. We all know what we need to, not we don't all know, but a lot of us know what we
Hmm.
need to be doing differently. And putting that into action is very, very different, right? So I think that maybe, the expectation you have of yourself can shift a little bit because yes, in a way, you can't get caught up in it, right? Because then
Hmm.
you're not present, but you can listen to it because I think sometimes what's happening with us in the session with a particular client gives us information about them. And even if you know
Hmm.
that this is your stuff is meeting his stuff.
Hmm.
And so, he's triggering your stuff,
Right.
but he has the ability to do that. Why does he have the ability to do that? Who does that say more about, you or him? Or what parts does it say about you? What parts does it say about him? So I think it's really important to pay attention to, not to just try and put it, over there, put it behind you and just be there. Because one, I think that that's impossible and it's an unfair
Hmm.
expectation you have of yourself, even though in fantasy worlds, like, wouldn't that be great?
Right.
But we have to be able to use ourselves, and use ourselves is really different than self-disclosure. I'm sure you know, right? It doesn't mean you have
Right.
to say, you're making me feel like this, right?
Right.
No, not in this situation at all, right? Somebody who we have a long-standing relationship with and who is pretty high functioning, you can use yourself in that way to say, I'm feeling like this right now. I'm wondering if you ever have thoughts about other people that may feel like that when they're with you, right? But
Right.
that would be too tantalizing for someone like this. That's not what we would want to do here. But I'm
Right.
just saying, pay attention to how you feel.
That's honestly something that I need to do, right? And it's great to hear it, and I do receive it, but then I think of myself and my patients, and I'm like, oh, it's so much easier said than done. I don't want to unpack it, because I know where it stems from. I know it's really difficult, and given these are the things that I require of my patients to do, and it's hard to do yourself, which is scary, you know. But you're incredibly right. I do need to pay attention to it because it does come up, but it's hard. I don't love it. It's easier to be a therapist than it is to be a patient.
Um, you know what? Not really.
Mm,
Because I believe and I demand, right, in a way, in my mind anyway, that anybody who is in the role of a therapist needs to be a client,
hmm.
needs to be working on themselves
Yeah,
continuously, because if we don't understand where our stuff comes from, then we're more apt to act on it and respond based on it rather than being able to manage it. And what you're talking about right now is struggling to manage it, to
right.
manage these feelings, right? And the only way we learn to manage it is to work through it. And that
Yeah.
takes more than just ourselves. It just does. And what's so interesting, and I think the irony, and I don't know if you're have ever had the experience of being a client, but the irony is that we have this belief that we can help others and that therapy can work for them, but yet we don't give ourselves the benefit of that. And
Hmm.
I always say that we're part of the equation, that if you think that you're going into this field just to help others, that you're sorely mistaken, because we need to be able to work our own stuff out in order to be in the position to best serve other people. So you might want to just take that under consideration. And not only because like you have stuff, we all have stuff. I always say therapists are clients too, right?
Right,
That you'll feel so much better, not only as a person, but in your work.
right.
But it's
You said
painful. It's painful. It's hard. It's hard work.
absolutely. And I think in the class that I took of yours while at Malloy, you said that a lot of people get into the field of social work to heal others, but also heal themselves. And that's something that I think I took your class in like 2019. And so that's something that I've taken with me throughout these last couple of years. And I think it's incredibly true. And things do continue to come up about myself. Some things I've actually really been able to unpack and move forward with. Some I'm struggling with, but it's a journey. But I do think that throughout my social work experience so far, I have been able to heal certain areas of myself. Which, yeah, you opened that thought for me, and it's something that I take with me in my practice every day.
Oh, well, thanks. And I'm glad. And it is a journey. It's a lifelong journey. I'm still on it. Right? It
Right.
never ends. As long as we're
Yeah.
living and breathing, we're constantly, faced with struggles and challenges that we have to work through. And a lot of those struggles and challenges are heightened because of our earlier experiences. And if we don't
Mhm.
kind of unpack that, as you said, it's a great word, unpack that, then, we just continue to live with it. And I don't know if we ever get rid of it, but it
Mm,
sure as hell can get easier.
yeah, absolutely. I think that's what I hold on to and something that I share with patients too, is that things can become manageable. They won't always feel like a 10. Some days they will, but sometimes it'll feel like a 2, and that's a great day.
A two in terms of a two being better, the lower the better, because
Right,
that's the good, that's the less intense feeling. Is that
right.
what you're saying? Yeah,
Yes.
yeah, yeah. Well, I can't thank you for sharing yourself in this way. Really, I think that so many people struggle with the feelings that you're struggling with. I think that was a great anecdote about boundaries and dealing with that. And what's the learnable, like? What do you want to share? What have you come through in the brevity that you've experienced as a professional, the time that you've spent, and that you can help others, and not even just newbies, but like, everybody is in this together.
Yeah, I think my biggest takeaway is that you're allowed to show up for what you want and ask for it. And if you don't feel like you're getting it, you have the ability to move on. Meaning if I'm not, I'm able to go to supervision. I have a great clinical supervisor. given, yes, scheduling is difficult, but I think that's a little bit different. But if I'm not getting the right clinical support, I'm comfortable saying, then I can't work with someone because I don't know what I'm doing. And I'm comfortable asking for those things. And I also think as students too, it's really important that if you're not getting something from your placement, if you're not getting something from your professors, you have the ability to ask for it because this is your life. You're going to be the one that's working every day. And if you're not feeling okay, you're going to be miserable. And that's just not fair. And that was a big deal with me with placements. Like, I was really annoying with placements, but I'm investing all of this money in my education. I want the experience that I want, and I think I'm paying for it, so I think I deserve it.
Yeah.
Um, and given, of course, there are a bunch of structural issues within social work. Again, like my caseload's really big. That's overwhelming. I don't love that, but that's something that I can work with. But what I can't work with is not feeling confident in my abilities as a social worker and not getting the direction that I need. So I think asking for what you need is really important.
Self-advocacy, along the lines of what we're saying is you need to be able to do some things for yourself in order to help clients do these things, right? So you
Right,
have to be able to self-advocate in order to help advocate for your clients. You have to have these tools, which is one of the reasons why I promote therapy for therapists. You
right.
have to develop tools in order to help others. But I'm so glad that you are getting quality supervision
Yeah,
because I think, unfortunately, there's not a lot out there these days. I think that
yeah,
people are so overwhelmed themselves as supervisors that, as you said, that gets rescheduled or it doesn't happen or it's
right.
missed or, a lot of obstacles to that. So demanding that as well is so important. And it sounds like you've figured that out, that you have somebody who's not only knowledgeable and helpful, but if you do have to reschedule, it gets rescheduled. You make sure that you
Right.
get what you need. Love the message. Come back anytime. Thank you so much. It was a pleasure.
Yes, thank you for having me.